Cardiologist, the heart doctor. Your heart beats around 100,000 times a day. That's 35 million times a year, without a single break, without a pause, without a restart button. And the cardiologist is the person whose entire job is making sure it never stops. Cardiologists specialize in everything related to your heart and blood vessels. That means heart attacks, heart failure, irregular heartbeats, high blood pressure, and blocked arteries. If your heart is doing something it shouldn't, beating too fast, too slow, or not pumping blood efficiently, a cardiologist is who figures out why. Here's what most people don't realize. Heart disease is the #1 cause of death worldwide. Not cancer, not accidents, the heart. That's why cardiologists don't just treat sick hearts. They spend a huge part of their work preventing problems before they happen. Stress tests, echocardiograms, Holter monitors. Some cardiologists go even further and become interventional cardiologists, the ones who physically go inside your arteries with tiny catheters to open blockages without open surgery. When should you see one? Chest pain, shortness of breath, irregular heartbeat, dizziness, or a family history of heart disease. Don't wait for a dramatic symptom. By then, your heart has already been struggling for a while. Neurologist, the brain and nerve doctor. Your brain contains approximately 86 billion neurons, each one connected to thousands of others, firing signals at speeds up to 120 meters per second. It's the most complex structure in the known universe. And the neurologist is the person who understands what happens when it starts misfiring. Neurologists treat everything connected to your nervous system, brain, spinal cord, and all the nerves running through your body. That covers migraines, epilepsy, multiple sclerosis, Parkinson's disease, and nerve damage. Here's a fact that surprises most people. Neurologists don't perform surgery. That's neurosurgeons. Neurologists are the detectives. They diagnose, they investigate, they treat with medication and therapy. The tools they use sound like something from a sci-fi movie. MRI scans that show your brain in real time. EEGs that read your brain's electrical activity like a seismograph. Nerve conduction studies that measure exactly how fast your signals travel and where they slow down. One of the strangest facts about neurology: migraines are one of the most common reasons people visit a neurologist. Not dramatic strokes or rare diseases, headaches. Because a migraine isn't just a bad headache. It's a full neurological event that can cause vision loss, speech problems, and temporary paralysis. When should you see one? Persistent headaches, memory problems, sudden weakness on one side of your body, tremors, seizures, or numbness that doesn't go away. Psychiatrist, the mind doctor. Here's a question most people get wrong. What's the difference between a psychiatrist and a psychologist? A psychiatrist is a medical doctor. They went to medical school, trained in hospitals, and can prescribe medication. A psychologist studied psychology, provides therapy, but in most countries cannot prescribe. Same field, completely different tools. Psychiatrists treat conditions where the brain's chemistry or structure is directly involved. Depression, bipolar disorder, schizophrenia, severe anxiety, PTSD, ADHD, and eating disorders. They're the ones who figure out whether what you're experiencing is a chemical imbalance, a structural brain issue, or something that therapy alone can address. Here's what most people don't know. Mental illness is not a personality flaw or a bad attitude. Depression, for example, involves measurable changes in brain structure and neurotransmitter levels. Schizophrenia involves abnormal dopamine pathways. These are biological conditions, the same way diabetes is a biological condition, and the numbers are staggering. 1 in 4 people will experience a diagnosable mental health condition in their lifetime. Yet psychiatrists remain one of the most under-visited specialists on the planet. Stigma keeps people away. Shame keeps people quiet. And meanwhile, conditions that are entirely treatable go unmanaged for years, sometimes decades. When should you see one? Persistent sadness lasting more than 2 weeks. Thoughts of self-harm, dramatic mood swings, hearing or seeing things others don't, or anxiety that stops you from living your life. Endocrinologist, the hormone doctor. Every mood you've felt today, every burst of energy, Every craving, every wave of stress, every moment of calm, all of it was controlled by chemicals your body produced itself. Those chemicals are hormones, and the endocrinologist is the specialist who manages them. The endocrine system is a network of glands: thyroid, adrenal glands, pancreas, pituitary, ovaries, testes, each producing hormones that travel through your bloodstream and tell your organs what to do. When one gland produces too much or too little, the effects ripple across your entire body. Endocrinologists treat diabetes, by far the most common condition they see, but also thyroid disorders, which affect over 200 million people worldwide. An underactive thyroid slows everything down: weight gain, fatigue, depression, brain fog. An overactive thyroid speeds everything up: weight loss, anxiety, rapid heartbeat, insomnia. They also treat hormonal imbalances that cause infertility, adrenal disorders, growth problems, osteoporosis, and conditions like polycystic ovary syndrome. Here's the fascinating part. Your hormones don't just control physical processes. They directly shape your personality, your emotions, and how you experience the world. A cortisol imbalance can make a calm person chronically anxious. A testosterone imbalance can cause depression in both men and women. When should you see one? Unexplained weight changes, extreme fatigue, mood swings with no clear cause, excessive thirst, hair loss, irregular periods, or a diabetes diagnosis. Gastroenterologist, the digestive system. Your digestive system is approximately 9 meters long, from the moment food enters your mouth to the moment your body is done with it. That entire journey is what the gastroenterologist specializes in. Gastroenterologists treat everything from your esophagus to your intestines. That includes acid reflux, irritable bowel syndrome, Crohn's disease, ulcerative colitis, liver disease, gallstones, celiac disease, and colorectal cancer. One of the most important things they do is colonoscopies, a procedure nobody looks forward to, but that has saved millions of lives. A colonoscopy can detect the polyps years before they turn into cancer. Caught early, colorectal cancer is one of the most treatable cancers there is. Caught late, it's one of the deadliest. Here's something that surprises most people. Your gut has its own nervous system. It's called the enteric nervous system, and it contains around 500 million neurons, more than your spinal cord. Scientists now call it the second brain. The gut also houses roughly 70% of your immune system, meaning what you eat doesn't just affect digestion, it directly affects how well your body fights infections, inflammation, and even mental health. When should you see one? Persistent bloating, abdominal pain, blood in stool, unexplained weight loss, chronic diarrhea or constipation, or difficulty swallowing. And everyone over 45 should discuss a colonoscopy regardless of symptoms. Pulmonologist, the lung doctor. You take around 20,000 breaths every single day, most of them without thinking, most of them perfectly, until one day, breathing becomes something you have to think about. And that's when a pulmonologist becomes the most important person in the room. Pulmonologists specialize in the lungs and the entire respiratory system. They treat asthma, chronic obstructive pulmonary disease, known as COPD, pneumonia, pulmonary fibrosis, sleep apnea, lung cancer, and tuberculosis. They also became some of the most critical specialists during the COVID-19 pandemic, as the virus primarily attacked the lungs. Here's something most people don't know. Sleep apnea, where your airway collapses repeatedly during sleep, stopping your breathing for seconds at a time, affects an estimated 1 billion people worldwide. Most of them have never been diagnosed. They just feel exhausted every morning and assume that's normal. It's not normal. And left untreated, sleep apnea doesn't just ruin your sleep. It raises your risk of heart attack, stroke, diabetes, and depression significantly. Pulmonologists also work with patients on long-term lung rehabilitation, teaching people with damaged lungs how to breathe more efficiently, how to exercise safely, and how to slow the progression of chronic disease. When should you see one? Chronic cough lasting more than 3 weeks, shortness of breath during normal activity, wheezing, coughing up blood, snoring loudly with gasping episodes during sleep, or a history of smoking. Dermatologist. The skin doctor. Your skin is your largest organ. It covers around 2 square meters of your body, weighs roughly 4 kilograms, and performs more functions than most people realize: regulating temperature, blocking pathogens, producing vitamin D, and sending sensory information to your brain constantly. And most people only think about it when it starts causing problems. Dermatologists treat over 3,000 different conditions affecting the skin, hair, and nails. That includes acne, eczema, psoriasis, rosacea, fungal infections, hair loss, and skin cancer, which is the most common cancer in the world. Here's the number that puts it in perspective. 1 in 5 people will develop skin cancer in their lifetime. Melanoma, the most dangerous form, can spread to other organs if not caught early. But, detected in stage 1, the survival rate is over 98%. That's why dermatologists spend a significant portion of their work doing something that sounds almost too simple: looking. Full-body skin checks that take 20 minutes can catch melanomas that would have been missed for years. They also treat conditions people rarely talk about, like hidradenitis suppurativa, a chronic inflammatory condition that causes painful lumps under the skin, or alopecia, where the immune system attacks hair follicles, causing patchy or total hair loss. When should you see one? Any mole that changes shape, color, or size. Persistent skin rashes that don't respond to over-the-counter treatments, sudden hair loss, nail changes, or just a full skin check. Once a year, especially if you've had significant sun exposure. Oncologist, the cancer doctor. Cancer is not one disease. It's over 100 different diseases, each with its own biology, its own behavior, and its own treatment. And the oncologist is the specialist who navigates all of it. Oncologists specialize in diagnosing and treating cancer, but the field is so vast that most oncologists further specialize. Medical oncologists use chemotherapy and targeted drugs. Radiation oncologists use high-energy beams to destroy tumors, and surgical oncologists remove them physically. Many cancer patients will work with all three. Here's what's changed dramatically in the last 20 years. Cancer treatment is no longer just chemotherapy and radiation. Immunotherapy, teaching your own immune system to recognize and attack cancer cells, has transformed outcomes for cancers that were once considered death sentences. Targeted therapy attacks specific genetic mutations in tumor cells, leaving healthy tissue untouched. Precision medicine now means 2 patients with the same cancer might receive completely different treatments based on their tumor's DNA. 1 in 2 people will receive a cancer diagnosis at some point in their lifetime. That number sounds terrifying, but survival rates across almost every cancer type have improved significantly over the last 3 decades. Early detection remains the single most powerful factor. Cancers caught before they spread are dramatically more treatable. When should you see one? An oncologist is typically referred to you by another doctor after a suspicious finding. But knowing your family history, attending regular screenings, and not ignoring persistent unexplained symptoms, fatigue, lumps, unexplained weight loss, pain that doesn't resolve, is how you make sure they catch it early.